My name is Tammy Evanow. I am a psychiatric mental health nurse practitioner with the Norton Neuroscience Institute's Memory and Movement Clinics. I collaborate with the medical providers to assist with management of mental health symptoms that often accompany movement and memory disorders. Today, I'd like to take the opportunity to talk with you about mental health and Parkinson's disease. When you think of Parkinson's disease, most of us think about problems with physical movement. These are symptoms that are easily observed and include tremor, slowed movement, stiffness, and poor balance. These symptoms are often referred to as the motor symptoms of Parkinson's disease. Parkinson's disease has many other symptoms that are not related to movement, which can impact your daily life as much or even more than the motor symptoms. These symptoms are often referred to as non-motor symptoms of Parkinson's disease. They are less easily observed by others, but more than 90% of people with Parkinson's disease will experience one or more of these non-motor symptoms. Parkinson's disease impacts brain chemistry and affects the production of neurotransmitters, specifically dopamine, norepinephrine, and serotonin. These neurotransmitters are very important for regulating your mood, energy level, motivation, appetite, and sleep. Many of the non-motor symptoms of Parkinson's disease can directly impact your emotional well-being. You may experience disruption of sleep, changes in mood, decreased motivation, fluctuations in cognition and memory, or symptoms of psychosis. Let's talk a little bit about each of these symptoms. One of the earliest reported symptoms involves disruption of sleep. In fact, difficulties with sleep may be present long before ever being diagnosed with Parkinson's disease. Sleeping problems can include trouble falling asleep and staying asleep, daytime sleepiness, vivid dreams, talking or yelling out while asleep, or physically acting out dreams. It's also important to address any undiagnosed medical conditions such as sleep apnea. Anxiety may be the most frequently reported non-motor symptom. People often describe increased anxiety in new surroundings, crowded spaces, or with changes in familiar routines. We anticipate that anxiety will occur in Parkinson's disease because of the fluctuations in brain chemistry. Feelings of anxiety are also impacted by the dosing schedule of Parkinson's medications. If medications wear off or are taken too frequently, fluctuations in dopamine can contribute to feelings of anxiety. Therefore, it's important to take medication consistently and collaborate with your movement specialist to find the right medication regimen that works best for you. Some medications can increase obsessive-compulsive behaviors and can lead to repetitive behaviors involving spending, eating, collecting, playing games, or taking medication. Many people experience periods of sadness related to daily stressors. This is considered normal. But more serious forms of depression can be debilitating and may last for weeks or months. Persistent depression can lead to feelings of sadness, hopelessness, guilt, or thoughts of suicide. Much like anxiety, depression is impacted by fluctuations in brain chemistry due to Parkinson's disease. In addition to fluctuations of mood, many people will struggle with apathy. People experiencing apathy have poor motivation and decreased interest in initiating or completing tasks. This is related to the depletion of dopamine in the brain. Apathy is often mistaken for depression, but there is a difference. Many people experiencing apathy describe their mood as relatively content rather than sad or depressed. Apathy is also more prominent in people with cognitive or memory changes that develop over time due to Parkinson's disease. Changes in cognition and memory are very common. Many people with Parkinson's disease will experience mild cognitive impairment with decreased ability to concentrate, plan, organize, and process information. They may also experience increased difficulty with processing language, memory, and finding the right words when conversing. Some people with Parkinson's disease may experience symptoms of psychosis involving sensory experiences and thoughts that are not real. Hallucinations can involve any of our 5 senses, but visual hallucinations are the most common. Visual hallucinations can range from mild passing shadows in the corner of your eye to more detailed visions of familiar people. Some people may have the sensation of someone standing beside them or behind them. Although hallucinations are not reality, they are real experiences for the person with Parkinson's disease, and they can be quite distressing. The level of distress is often directly related to cognition and insight. Persistent hallucinations often lead to delusional thoughts or fixed false beliefs. It is important to recognize these symptoms early so you can talk with your movement specialist about treatment. Early intervention will improve the likelihood of positive responses to treatment. Your emotional well-being directly impacts your ability to consistently maintain healthy lifestyle choices to slow the progression of Parkinson's disease. To learn more about movement disorders or the Norton Neuroscience Institute Movement Clinic, go to nortonhealthcare.com/neuroeducation.